respiratory therapy, pharmacy to the ER, room 55. Respiratory therapy, pharmacy to the ER, room 55, stat. Respiratory therapy, pharmacy to the ER, room 55, stat. And welcome to Trauma Y and Crash. I'm Y.
And I'm Crash.
And this week we want to throw a big shout out for all the pharmacists and farm techs out there. It is Pharmacy Week.
Yay.
And we want to throw out a big thank you because I tell you what, vital, essential times 5. Would you agree?
Pharmacy is your best friend. Oh, yeah. Pharmacy is always your best friend. Ever since I've been a nurse, I've always gotten to know pharmacy, the people in pharmacy, because they will save your life or make your life much, much easier.
I totally agree. And for you new grads out there and people just moving in different areas, one of the key people to know is to know your pharmacist because they can answer a lot of those questions and they can tell you why. They can help you with policy and procedure, but they will help guide you. And they are a vital resource that we need to use.
Yeah, people that coming out, the new guys, I always tell them pharmacy is your best friend, and they are your best friend. Other than the nurses you work with, pharmacy is someone that will, once you get to know them, help you a lot because you can have drugs or drips, and you can know what you're doing, and just be say 5% unsure about what you're hanging or what you're doing, and you can call them. And I recommend you call them, even though you know, because every once in a while you are off or wrong. Call pharmacy and ask, and they'll be happy to help you and tell you, well, yeah, you're right, or yeah, you're wrong.
Oh, I'm sure, because you know what? They'd much rather talk to you before you make a mistake than after.
It won't be the only one.
No, and I tell you, now when I first start working in the ER, especially in the ER is where I really feel it. But when I was in the ER, we mixed everything. We mixed all of our own antibiotics. Come to find out later, we probably mixing some stuff we wasn't supposed to be mixing because they were like, "Oh, you can't do that no more." And we didn't have pharmacists, so we mixed everything. We mixed our own dopamine, everything. So I was pretty comfortable in mixing it, and that was fine. But you have to wait on stuff, or in the middle of codes, and there's not that many people going because we'd have a couple traumas going on, a code going on, and you sitting up there and you got to have another person just to mix drugs. So, I mean, it was a lot, and you had to know where they were, and then you don't mix them as quite as fast and things like that. But when we got a pharmacist in the department, it was, man, changed our world, and it helped to let us know how fast everything could get. And you had a great resource for the patients. They do patient education, help you troubleshoot some things. Even the farm techs, they help out with a lot of that. They do a lot of the medicine reconciliation, and they find stuff out. You don't even know much about the patient not talking, and guess what? They'd be like, well, I can tell you they're on a blood thinner, they're on such and such. They just had it filled last week. Helps tremendously.
Yeah.
Tremendous. I could not fathom working without them. I could not go back to the old way.
Yeah, because we used to mix ours too.
Yeah.
In the beginning, back in my day, we mixed neoepinephrine and other drugs and pressures that we needed. We had them in the refrigerator and had the 250 bags, and we mixed them.
Yep. And then it just makes it so much easier and so much better for the patient to have that expert in that field right there to help make sure you push it, even when you push it or you go to do whatever, just to help throw out those little reminders. They are a vital part, especially in the ED and my ED. They're a vital part of the team. They are not an outsider. They're considered one of us. I bet you some of the ED pharmacists, they consider themselves more ED than pharmacy. Well, ish, I should say. They coexist, which is a big key. But they all fit in, and I've been blessed. I've worked with nothing but really great pharmacists. Now I've had times when I haven't, but like our ED pharmacists, have always been the pharmacists that are on the ball. But for the most part of my career, they have always been nothing but a great resource and somebody to work with. Great with patients, great with staff, really good with new nurses. as they're learning, great with the residents, because sometimes, you might have a resident or a doc that's trying to use a med that is like, no, you can't use that. We need to use such and such.
Nope.
And they don't want to listen to you, but they'll listen to the pharmacist. Or they're trying to figure it out, and the pharmacist is standing behind you looking at them like nodding their head like, you probably really need to listen to them. It's just another vital part of the team. So we want to say happy Pharmacist Week. Hopefully your hospital's recognizing you, but I know with COVID, a lot of times, a lot of people aren't really getting recognized. But just so you know, we definitely matter. We care.
Yeah, we do. And I want to say, shout out to Pete and on the hospital I used to work with, an older guy that was a pharmacist. He was above and beyond. He would bring stuff when I needed it or when we needed it. He would come up. He was just an all around great guy. I don't know. I won't say. Well, I don't know if I can say where I used to work, but anyway, Pete was a good guy. Even though I met him outside of the hospital, he was just a very good guy. So I like to say thank you, Pete, and go pharmacy.
Yeah, shout out all the night pharmacy team at night. They all are on the ball. I mean, something start to go wrong. You over in CAT scan with a critical patient. You look up, Ricky's standing right there. All of them are great. I'm gonna shout them all out because they do a fantastic job. And like I said, blessed to be able to work with people like that.
Yeah, so, they are the best. They are your best friend. Never forget.
That's right. They are. So everybody, make sure y'all throw some love to the pharmacy and pharmacy techs out there. They help make a difference, and they make our lives a ton better, which in turn really, really, they help keep the patients alive. So
Yep.
This is Trauma Y.
And Crash.
Y'all have a good one. Stay safe.
Be safe.
Code Blue, ICU. Code Blue, ICU. Code Blue, ICU.